I have a patient today with this line placed. Came in for non-functioning, unable to draw blood, painful during medication administration. He said he already had 2 to 3 centimeters external when he came out of the hospital. The care maintenance nurse pushed it in to 0. We're going to see exactly under. And of course, the disc is turned improperly. Tell me why or what's wrong with this disc. What's wrong with what you see here? And we're going to show you why it's wrong. When you first got it put in, what happened?
Okay, when I first got it put in, the hospital put it in, and they was having a problem because she said when she pushed it in, something was blocking it. So she pulled it back out a little bit, and then pushed it in and put it back out, pushed it in. Then she got it in. So I told her, I said, y'all killing me. This thing hurts like a mother. So they numbed it like 2 or 3 times.
Did it feel better after the numbing?
No, I felt everything she did.
Patient wasn't numbed properly for the procedure. It wasn't even turned up. It was taped to the elbow where the crease is, where I know I disrupted the dressing here, but you can see dressing already flaking off. So
I just taped it because it was coming off.
So even at the elbow, did you have a hard time moving this elbow around?
No, but it was just uncomfortable when it's right there in the middle of my crevice where I've been my arm at.
It was reported that blood was difficult to withdraw.
Yeah.
And flushing was fine, right? No problems flushing?
Well, it burnt when I flushed. It'd be burning.
So it burned. Where? Can you point to me in your arm where it burned?
Right here, like this.
That whole area burned. And after you flushed, you did try to put the medication in, right? You let the ball.
I mean, it went in, but as it was going in, it'd be burning, like it didn't burn the first.
Did it burn up here at all?
It burnt like right here and up under here.
First of all, what's wrong with this picture? What's going on here?
I have the slightest idea. You can see
the nurse placed this upside down. You need to make a complaint about whoever's changing this dressing.
It's upside down?
Yeah, it's not even doing anything. This bio patch is meant to clean and keep that area disinfected. But this bio patch label, it's supposed to be facing out, not on your skin.
Is that right?
Do you see the spongy part?
Yeah.
That's supposed to be on your skin. Is it on your skin, the spongy part?
No.
No. The problem is, do you see how, because of the way that the slit was turned, now it's difficult to remove this. And so you're gonna, when you try to remove this disc, you're gonna be pistoning that catheter out, like so, trying to remove it.
It has a split in it.
Yeah.
See right there?
Yeah. That slit was supposed to be pointing this way, not that way. So she had that slit backwards as well. So this was a poorly changed dressing. We're gonna remove this. I'm gonna put down the camera. All right, so we have here, looks like from the 8, whatever happened here at the 8 centimeter mark. Yeah, there's a rupture in the catheter. So this is why it's important to flush and check your line before you administer medication.
I used to have to sleep with my arm, straight out.
And you were comparing your other arm?
This one is comfortable. This is comfortable right here. But this one, I couldn't sleep, but in certain positions.
Yeah. You said it feels really sore right now.
Yeah, it's sore. Look, you see how that is like that? Look, my right arm ain't as big as, I think that's where that fluid was going. You said it had a hole in it, didn't it?
And you're saying this is a lot more comfortable.
Yeah, because see, look, it don't have that flap as much.
But, well, this also isn't in the way of your elbow.
Right. See, this one, look at this, man.
That line was all sticking out this way, right?
Look at this. Yeah, that was the extension part to it.
So this is why we consider this the red zone. Not only was it uncomfortable for the patient, but can you bend your elbow for me? When he bent his elbow this way, it was actually pressing up against the